Hello, everyone. Good evening, and welcome to the latest episode of our Minor Talks series. So, when you hear the word psychiatry, what comes to mind? Can psychiatrists actually read our minds? Or do they only treat crazy people? Or are they just doctors who give out medicine and listen to our problems? Well, tonight we're going to clear all of those doubts. So, stay with us as we uncover the truth behind the myths, explore the science behind the minds, and answer the big question of the night: psychiatry, mind reader or brain doctor? My name is Nikita, and I'll be your host for this evening. We're incredibly honored to have with us Dr. Lim Po Ting, the director and consultant psychiatrist at the Blue Mind Specialist Clinic, located in Penang. Dr. Lim is also a member of the Royal College of Psychiatrists in the UK and holds a Doctor of Medicine degree from the Nizhny Novgorod Medical Academy. Dr. Lim, thank you so much for taking the time to be here with us tonight. We're really excited to hear your thoughts and experiences on the field of psychiatry.
Thank you for having me. Hi, everyone.
That's great. Okay, then, let's get this going. And let's start with something that many people often wonder about. Psychiatry seems to deal a lot with both the mind and the brain. So, Dr. Lim, how would you explain what psychiatrists really do?
Right. So when it comes to psychiatry, well, if you follow the job description, we treat mental, emotional, and behavioral disorder. But that wasn't very explanatory, isn't it? Like not very illustrative. So another way to think about psychiatrists is that whatever your brain does, if it's not doing it very well, then psychiatrists are there to help. So the question would be, what does a brain do? So you can say that if a child brain is not growing up well, so the brain also do the growing up thing, right? So if the brain have troubles in growing up, for example, having learning disability or trouble with attentions, deficit and hyperactivity, or trouble with autisms, then psychiatrists are there to help together with pediatricians. So there's some overlap. And what else does the brain do? The brain do the sleeping part and the memory part, right? So if a person have insomnia, the person have dementia, psychiatrists are there to help. What else? The brain do emotions, so our mood. If we are too down, too depressed, psychiatrists are there to help. If our mood is too high and it can't come down, so we call it a manic phase, then psychiatrists are there to help. What else? We do memory and perception. So, memory we mentioned, right? So we do also do the perceiving and sensory. So your brain interprets your surrounding, detect all the five senses: your sight, your auditory senses, your tactile touch senses. So if you're hearing things that are not there or seeing things that are not there, then psychiatrists are there to help. Then other things, behavior, personality. So if someone have personality disorder or someone have wasn't behaving according to what they want or like what society deem as acceptable, then psychiatrists are there to see what are the issue here and if there's anything we can help. So that's what psychiatry do. It's a very broad field. So whatever your brain does is if it's not doing it that well at all, you just wonder like why is it doing that? Psychiatrists are there to assess, to interpret, and help. Hopefully, we are able to help. And your second part of the question is like, do we treat the brain or the mind? This is a little bit of a philosophical questions. It can be because what are our mind if it's not the projection of our brain, right? Whatever your mind is currently thinking, whatever you are listening, you're hearing, or you're thinking, it is the result of some like chemicals or some electrical activity of your brain. So in this podcast, if you learn something new or something change your mind, then your brain will literally change with it. It's not obvious, but some neural connection will be made, some new link, some chemical will be released, some electrical activity will happen there. So it's very hard for us to differentiate like are we treating the brain or treating the mind? Because essentially you are treating one, it will affect the other. But obviously, I know this is not your questions per se, right? Most of us think about brain as the hardware, the big things where we can touch, which we can see from MRI or when we do autopsy, we can see it. And mind as something abstract, it's just about the thinking. Now, if we put it in that context, if you want a career of looking in the brain, like doing MRI or do all the things that electrodes can measure, then you're probably thinking about a career of neurologists or neurosurgeons. because then you'll deal a lot with the big brain, big part of the brain. If you don't want to do anything of it, you want just to deal with the thinking part, then you are probably looking at a career of a psychologist or a counselor. So psychiatrist will be somewhere in the middle. So we see some MRI, some subfield of psychiatry will deal a lot with MRI, brain structure. We think a lot about that. And even if you are not in that subfield, you will be thinking about neurotransmitter, receptors, dopamine, melatonin, noradrenaline, those things a lot. But we also examine a lot about the thinking part. So it's sort of a mix, depend on what kind of psychiatrist you are, but you definitely have to do a little bit of brain and a lot of like the thinking part too.
Wow, that's a really clear and also relatable way to explain it, Dr. Lim. And I think a lot of our viewers are going to see psychiatry in a new light after hearing that. In fact, even I'm starting to see psychiatry in a new light after hearing what you said and explained. Well, now speaking of how people view psychiatry, I want to touch on something a bit related. Psychiatry is often misunderstood compared to other medical fields. So, what is one common misconception about psychiatry that you'd personally like to clear up once and for all?
Right. It's hard to think about like one misconception, but there are a few. I think the one biggest thing is that people think psychiatry or psychiatrists as just doctor who treat crazy people. So when we talk about crazy, in medical term, it will be psychosis, where a person is breaking from reality. So hearing things that are not there, hallucinating, or believing things that are not there, or acting unusually. So there will be a medical term, psychosis. But psychiatry is not just the field of treating psychosis. So when I introduce myself to other people's, especially at parties or social events, I try to remind them that we treat insomnia too. So something very relatable, something everyday life, so that they sort of like anchor them, try to understand that psychiatry is not only just psychosis, but also normal things such as insomnia, daily life stress, work-related stress. So we are a very broad field. But beside that, psychiatry itself has a lot of misconceptions because psychiatry kind of is a field with a lot of nuances. So if you think of a psychiatry or any aspect of psychiatry and you can think of like quick, simple answer, a clear answer, then it's probably a misconception. For instance, a lot of people thinks that people with psychiatry, mental illness require lifelong treatments. So it's a very, very quick, like an idea, a stereotype. Which is not true. It's true for certain type of illness, like for example, schizophrenia, and even then, it's 99% of all the patients, not every cases. So otherwise, it really depends on the illness. Another misconception that a lot of people think about is like all the medications, all psychiatry medication are addictive. So once you take one medication, you get hooked on it for life. And that's true for benzodiazepine, just one class of medication or sleeping pill. And it's not true for other class of medication. So there's a lot of nuances every time. Another things that a lot of people keep talking about is depression and anxiety is about a person's own resilience. They have to work on it and then come out from it by themselves, by their own strength. Doctors, other people can just help that much. And it's not exactly true too. We know that a person's mental aspect, the psychological aspect, is an important factor, but there are also like chemicals, hormones that plays equals amount of, if sometimes more. So again, like psychiatry is a field that with a lot of nuances. So there's not quick, easy answer. So if there's a stereotypes on it, it's probably a misconceptions.
Yeah, I think those are really very important points that you brought up. And I also think that those misconceptions really affect how people approach mental health as well. So I'm really glad that you brought all those points up. Well, now, building on that, one big part of psychiatry that people often wonder about is treatment, especially the balance between medication and therapy. Some people think psychiatrists mainly prescribe medication. Other people imagine that you just listen and talk. So, in reality, it's really a lot more nuanced and complex than that. So, how do you decide when a patient needs medication, therapy, or maybe even a combination of both?
So most of the time it's somewhat a combination of both, right? But it really depends on three things. I would say that one is depend on what kind of conditions we are talking about. The second is about what kind of persons, the person itself, not the conditions, but the person, what kind of person that we are looking at. And then the third will be what kind of resource that's available at these situations. So let's talk about illness first. There are some illness that is mainly medications, treatments, and psychological treatments like talking therapy, counseling are not the main treatments, even if offered is just to support the person, helping the person to cope with the illness. Let's say like schizophrenia, when a person is hearing voices and seeing things and having like false belief that disrupt their life. Now, those the illness are mainly due to the imbalance of dopamine in the brain. So the treatment is mainly medication to sort of like restore those balance. You can't talk your way out of psychosis. So the medication is the mainstay of treatments. And other example, for example, depression and anxiety. So we all practice evidence-based medicine. So it depends on like what evidence shows that medication helps or doesn't help. So when it comes to depression and anxiety, for example, mild cases, we know that medications are more like case by case basis. It doesn't it's not helpful in every case. So you have to be very deliberate and consider everything when you are trying to prescribe medications. So most of the time, the main treatment would be psychotherapy, and we try to offer that if we see a patient with mild and moderate anxiety or depressions. So it depends on illness. Then the second factors we mentioned just now is depend on the patient itself, the case that we are seeing right now, because everyone is different. So when a psychiatrist and if I'm not mistaken, even a psychologist, when they are treating a patient, we have this process called formulations. So we try to think about the patients in three broad ways. We try to think about all the biological factors that's affecting the patient. For example, family history, genetic history. Does the patient have substance abuse? Is the patient unwell because he or she has some chronic illness? Or for example, a person with a heart attack, usually due to some chemical release, will have depressions or anxiety. So we try to think about all the biological factors and try to address them. Then we think about the psychological factor. So the personality of the patients. Does the patient has a coping skill issue that we can try to make it better so that he or she copes better? Does the patient have some negative self-belief that we can address? So if those things are present, then perhaps we think about like teaching the patient some psychological technique or doing some formal psychotherapy, like talking therapy, counselings to help the patient address those. Then we move on to the social parts. So one thing very important to know is that a social factor is a very powerful driver of a person's well-being. So it's much more so than a psychology, sometimes more so than biology. So the work environment, the home support systems, the social situations, the financial situations. So is there anything that we can do to address those, mobilize support, get more people to support, family supports, friends to support the patients? Or if the work environment is too unconducive, like too unhelpful, is it worth to change the jobs? So those are in discussions. So we try to think about this, like all the aspect like of a patient, and try to give a very holistic treatments. So bio, psychosocial, right? Then last factor is the resource availability. So in private, obviously, it means that do you offer those service? And if you don't, can you get the patient to go to the other service provider that has that kind of service? But it also means that does the patient have the financial resources to go through all the treatments? Like for example, psychotherapies are not it's not really cheap, right? So 200 ringgit per sessions, and you need to go through more than a few sessions in order to complete the treatments to have an impact. So does the patient have those financial resources for all the treatments models that could help him? This one thing, but even in government sector, because I was working in government sector until recently, early this year, I was there about 7 years, 8 years. So even in government sectors, different places have different resources available to them. So does your center, your setting has those resources to offer to the patients? For example, social workers, are they available in your centers? Occupational therapists, psychologists, counselors, are they available in your centers to help? So when we talk about like resources in governments, there's also one things to, since our listener are a lot of like people who are interested in medical fields, perhaps still thinking about their career. That's one thing interesting to share is that in government sectors, in public healthcare, KKM, psychologists are very rare resources. We have severe lacking of clinical psychologists, and both due to the um, government resources not able to hire as many of them, and also mainly due to that we don't have that much clinical psychologists around. In Penang itself, we have maybe like 4 or 5 clinical psychologists at one time, and that's to serve the whole state. So the resources is not very available, and that's one thing that we think about. So case by case basis, depend on the illness, depend on the patient itself, and depend on what resources you can get for the patients.
Well, that is a really structured, not only structured, but it's also a really thoughtful approach. I really like how you emphasize that it really depends on the individual's needs. So it's like a not a one size fits all method. You really prioritize it according to the individual, according to the case, and that's what I really like about your field, actually. Okay,
Yeah,
so
it's a fun field. It's very
yeah,
interesting.
it does sound really fun, actually. Okay, so all right, so now let's move from the medical side onto something a bit more personal, your own journey into psychiatry now. So, what we really want to know now is what inspired you to choose psychiatry as a specialty, and how has working in this field really shaped your overall view of medicine?
I think I was really interested in psychology ever since like I was in high school. So the obvious things to do is to study psychology and get a degree in psychology and maybe master in clinical psychology or academic. But my family, my parents are reasonably worried about the prospect of financial prospect of being a psychologist or studying psychology because it's not very clear. So they suggest, why don't you study medicines and then you can further into psychiatry if you are still interested in psychology. Because it will give you a very versatile career. Even if you don't get into psychiatry, you can go into different kind of medicines. And it works out for me. I went into housemanship. I did my psychiatry posting as a houseman. Then I went into Institute Hospital Per Mind as a medical officer, then continue my training, get my MRCSI para pathway paper, and become a psychiatrist in Penang. So for me, it's a very smooth journey from a medical student to houseman to medical officer to a psychiatrist. Um, to those who are in medical school, I'm sure, and I hope you are aware that it's not easy to get into the field that you want. So I'm very grateful that my journey is very smooth, because many of the smaller field like psychiatry or maybe ENT or ophthalm or blood bank, things like pathology, a small field like us, usually there's not much like a turnover. So sometimes there's a queue to get into the departments. So when you're a medical officer, sometimes it takes a year of waiting time or 2 years of waiting time in order to just get into your department of your choice, the specialty of your choice. Like for me, psychiatry. And then you need to queue up for master program for training in order to become a psychiatrist again. So it's a long journey. So yeah, just to be mindful about that. Um, and what changes do I see like in medicine for after practicing psychiatry? It kind of give me a more holistic view about and more nuanced look about treatments and in general, medical treatment in general, because some other field all the treatments are quite straightforward. Like a person with broken femur, you try to fix it up. Like a person with URTI or pneumonia, you try to treat it. It's very straightforward. But in psychiatry, there's a lot of like discussions and a lot of nuances, a lot of different treatment approach. So, for example, a person with anxiety, like, do we treat the anxiety aggressively, or do we just help the person accept that, sometimes they feel anxious and we don't have to eliminate all the symptoms? It's sort of like a oncology end of life care. You know, do you treat the cancer aggressively, or sometimes you just choose to live with it? And there's a lot of it in psychiatry. Like each and every cases, there will be some part of like a thinking, like discussing with patients, like what are we doing? It's not necessarily just an illness and you treat it, and you treat it as much as possible. And yeah, there's a lot of like a nuance and a lot of like a very deliberate approach to treatments in general. So that's something that I really like, and I feel difference about psychiatry in general.
Yeah, I can see that psychiatry really has like a different approach to medicine when compared to the other specialties. And also, it's really inspiring to see how you've had that passion from such a young age and you've managed to hold on to it as you grew up. Like, that is something that's very rare and also it's also very admirable as well. And I also imagine that that passion also helps you navigate like the emotional side of your work, which actually brings us perfectly to the next topic,
Mm.
and the next question. Okay, so psychiatry can be emotionally demanding since you're helping people through some of their most difficult moments. So, how do you take care of your own mental well being while taking care of so many other people's well being?
I think one of the important thing to say is that I actually don't feel that treating helping people with mental illness or mental health difficulties are that draining, because unlike many other professions or like even other field of in medicines, when a person, for example, you are orthopedic doctors, auto surgeons, and then you have a patient with broken femur, and he or she has also like schizophrenia or some anxiety issue, and it really will makes you feel tired and burn out trying to fix the femur, the broken bone, while also like helping the patient to understand the treatments and pacify him or she, helping her to feel comfortable with the treatments. So it burns the orthopedic doctors out, because you are trying to get to the end point of like fixing a broken bone, and the psychiatry issue are just like distracting you and just making it difficult for you to do your job. But in psychiatry, it's different. The mental health issue itself is the thing that we are addressing. It's the subject itself. It's not a distractions. So it become much easier for us to, spend the time and then just focus on the mental health difficulty. So it become easier for us. And most of the time, when a person is coming to us for mental health help, both of us want the same thing. So the patient want to get better, we want the patient to get better. So it is a smooth journey when two person are wanting the same things. So it is most of the time not that draining to help a patient with mental health issue. But every career has their tough part, and I would say that the things that a psychiatrist face in public sector, for example, are not that different from like what the other doctors face in the public sectors. It's about the work culture, about the teams, about the administrative requirements, about the workload. So those are the same challenges that other doctors in other field face, and then this is what the psychiatrists in hospital face too. So it's about the same. And what would I say that are the things that we can do to cope better, or to make sure that our mental well-being are taken care of? I think it's a very common like a recommendation to everyone is about introspections, to understand how you feel right now, understand if you are out of balance, to understand what is tilting you out of balance and try to address them. So very deliberate, like very try to be as aware on like how you are feeling, what's your mind space like, and how you spend your times, and what you put your attention to. So it's the same advice for everyone, not just we apply as a psychiatrist, but like for everyone in different career.
Yeah, I think that that's really important advice. And I think that almost everyone will be able to benefit from it, even our viewers right now who are currently in medical school. Even me, I think I'll probably be able to benefit from the advice that you're giving right now. Okay. So, okay, so now one major challenge that I really want to talk about now is the stigma aspect now. So, unfortunately, stigma is still one of the main reasons why many people hesitate to seek help from a psychiatrist. In your opinion, what can be done to reduce the stigma and encourage more people to reach out when they're struggling?
We really see that since COVID years, since 2020, there's a lot more like awareness programs done by both people from mental health professions and also different NGOs, government bodies, non-government bodies, doing a lot of work trying to promote mental wellness. And those things do make an impact. And we also begin to see a lot of like younger people of your age, like 20 somethings, like come walk into mental health clinic themselves because they saw someone on TikTok or IG that share about their mental health struggles, and then they decided that, oh well, since the person is like seeking help, maybe I should too. So it really really helps. I think what the NGOs and government bodies and people from mental health professionals, we are really appreciative about this movement, and I think continuing that would probably help. Well, no, I would definitely help, right? But another thing for people from public spaces, like normal people, I think talking about mental health helps. But another thing is that to be mindful is that when we talk about mental health, we have to talk about it in the mood of like kindness and compassion, because there's also a lot of talks about mental health that is just gossiping, right? So somebody in the news have mental health illness and did something strange, and then there's a lot of talk and discussion about it, but they are not coming out from the um, um, from kindness, from the heart of kindness, and it's just gossiping, and it doesn't really help. It really enforce the stigma. It would really just deepen the stigma. So talking about mental health in general helps. We need more hero story. We not need more survivors that are willing to come out and share their stories, and then just creating the awareness definitely do help. Yeah.
Yeah, I think that that's a really like important thing. I've also been noticing like since 2020, 2022, there's been a lot more awareness as well. And yeah, I think that that's like a really important statement that you're making right now. So we're so glad that you're making that. Okay, so now I'm sure that many of our viewers, many of the students watching, they're feeling very inspired right now. So let's talk about what it takes to walk this path with like one final question for tonight. For some of our students here who may be considering psychiatry as a future career, what kind of qualities or mindset do you think is the most important for aspiring psychiatrists, and how can they start preparing themselves while they're at school or university?
Right. I think we have to start by saying that you don't have to have a certain quality in order to become a psychiatrist. Like some people believe that you have to be extroverted, like you like to talk, and only then you should get a career of like talking to patients and spend half an hour, 1 hour and a half talking to a person. I think it's evidently a false misconceptions, because there's a lot of colleagues that I have that's doing very well, helping you know, very popular for patients, doing well for themselves, that they are not extroverted. They are pretty introverted. And to think about it, like most of the time that you spend with patients, you are there listening and thinking, and you are not really talking. So you don't have to be an extroverted person to become a psychiatrist. And you don't even have to be a certain kind of person, because different kind of psychiatrists help in different manners. If you are very friendly, then you tend to are able equipped to help with a patient who needs a friendly psychiatrist. But there are also other patients who wants a psychiatrist that's very matter of fact, that just tell them what they need very strict and without like much like bubbly language. And they will be more receptive to that kind of psychiatrist. So different kind of psychiatrists will help differently, and they will be good for different kind of patients. And even then, when you are doing your training, you sort of overcome your weakness. So if you notice that you are too soft on patient, you're too permissive, and you are not able to help them to make the changes that they need, or you're not comfortable in confronting them when they are not helping themselves out, then you sort of like try to you're able to overcome that kind of your weakness, make yourself more comfortable during the training. So you don't have to start as someone. You will end up with the persons that a psychiatrist that can help. So that's one thing. With that being said, if you are interested in psychiatry and you want to, be the best psychiatrist that you can, straight starting from medical school or even before that, what you can really do is to read tons of self-help books or psychology books or anything. You just read them, because there's a lot of time where my patients, like sometimes with medical background, ask me like, oh yeah, this is a really good suggestion that you made. Where did you learn those skills from? And I can't really recall, and I know for sure that it's not from my psychiatry training. It would be from a book somewhere in the past, which when talking to a patient, it just makes me remember that these skills, and it's very applicable for the current patients. So reading a lot of a lot of self-help books definitely will help, and reading a lot about psychology and sociology would help too, because it help you just build a better picture of like how humans like, how the psychology works, and then different tips and tricks that could just help one of the particular patients.
Yeah, I think that's a really valuable insight, valuable advice as well.
Mm,
So, everyone in the audience, please take notes right now. Okay, I think this will really resonate with our audience and help them in the future as well.
mm.
Okay, so Dr. Lim, this question marks the end of this interview today. Thank you so much for sharing your experiences and all your insights with us tonight. Your words have really given a much clearer and deeper understanding into what psychiatry truly is. It's not just about treating the brain, it's also about understanding the mind and the person behind it. To
Thank
everyone
you very much.
watching, thank you. Thank you so much for joining us again.
Yeah.
And yes, to everyone watching, we hope this session has helped you see the heart and the science behind psychiatry and maybe even inspired some of you to consider this field in the future. So, yes, once again, thank you so much, Dr. Lim, for joining us. And also, thank you to our audience for tuning in to this Minor Talk episode. So, we wish you all a good night. And until next time, take care and stay kind to your mind.
Take care. See you.